Ladies and gentlemen, today, please join me as we welcome physician Tay to tell us more about TCM and how it can help you benefit your liver. Here we go.
Hello. Thank you, James.
Is it like this?
No, it's 3 fingers. Right. Hello, everybody. Good afternoon. My name is Junie Tay. I'm a TCM physician with Parkway, Shenton. So today I'll be sharing about liver health from the TCM's perspective. Just a short introduction about myself. I graduated from NTU with a double degree in Biomedical Sciences and TCM in collaboration with Beijing University of Chinese Medicine. So I've been practicing for the past 12 years, and currently I'm doing my TCM Masters with a focus in gastroenterology disorders. So for today, I'll be covering the function of the liver in Western medicine. In Chinese medicine, the main bulk of the time I'll be talking about the management of fatty liver, and a very small portion will talk about the TCM theory of how the liver opens into the eyes, and lastly, I will conclude. So firstly, the functions of the liver in Western medicine. I think Dr. Louis has covered most of the functions. So we know that the liver is an organ that's part of the digestive system, and it filters the blood that comes from the digestive tract before passing it on to the rest of the body. So the other functions include the detoxification, production of cholesterol, storage of micronutrients, it balances our blood sugar, produces bile, proteins, plays a part in our immune system and metabolism. So how about in TCM, in Chinese medicine? When you see a TCM physician and you are told that your liver function is not ideal, we are actually not referring to the anatomical organ of the liver in Western medicine. So here I represented the liver in a very abstract drawing because in TCM, its function can be quite abstract. It's known as a concept, a principle, or a theory. So what do we talk about as the functions? So primarily the functions of the liver in TCM is to ensure the smooth flow of qi in the body. So qi is a very specific term used in TCM, and it can be understood as the general flow of energy in the body. That circulation of qi is very important for a lot of functions in the body. So if, let's say, that something happens to the circulation of qi and it's blocked, you might experience some pain, cramps, headache, dizziness, or ringing in the ears. This qi flow is also important to regulate our digestive system. So if qi flow is stagnant, you might feel bloating, burping or flatulence, some acid reflux, or constipation. Qi is also important to regulate our emotions. So a lot of times when liver qi is stagnant, you might have some emotional disturbances like depression, anxiety, or insomnia. So another important thing is we say the liver opens into the eyes. So when the liver blood is abundant, your vision is clear, and it's moist. So if, let's say, the liver blood is deficient, you might suffer from dry eyes, red painful eyes, blurry vision, or poor night vision. In Chinese medicine, a lot of gynecological problems are linked to liver function. So we would target the liver function if you have irregular periods or excessive periods. The liver also controls the sinews for better movement, so that includes your tendons. If the liver function is not doing well, you might suffer from tight muscles, muscle cramps, and numbness. So externally, the function of the liver manifests in your nails. If the liver blood is insufficient, you might get thin, brittle, or pale nails. So this is a very brief introduction into the functions of the liver in TCM. Today we'll talk about the management of fatty liver, but we'll come back to that later. So as Dr. Louis has covered, fatty liver is a prevalent chronic liver problem, and now it's affecting more people. So there are 2 main types. My colleague has covered the alcoholic fatty liver disease. There is also the non-alcoholic fatty liver disease. So for non-alcoholic fatty liver disease, it occurs when the fat accumulates in the liver even without excessive alcohol intake. So as we eat better now, there are changes in lifestyle and diet, this has continued to increase. It often has no symptoms, so a lot of people find out about it only when they go for their health screening. So when they do have a little bit of symptoms, they might have some fatigue, a general unwell feeling, or some pain or discomfort in the upper belly area. So in TCM, we call it 肝脾, and it's a consequence of excessive high sugar, high calorie and greasy diet, sedentary lifestyle, and emotional distress. In TCM, we believe that the liver diseases mainly take place in the spleen and the stomach. Therefore, strengthening the spleen is not only a treatment, but can also prevent the further development of liver diseases. So again here, please note that when I talk about spleen and stomach, I'm not talking about the organ itself, but in TCM we refer to it as a digestive system. So Western medicine and Chinese medicine might view non-alcoholic fatty liver disease in slightly different ways. If you and the person beside you have fatty liver, the same kind of diagnosis given to you by a Western doctor, when you see a TCM physician, we might give you different herbs because you have different body constitutions. So we have this called the syndrome differentiation, which puts you in different syndrome types, and we would guide our treatment plans for herbs and acupoints accordingly. So how can TCM support fatty liver management? TCM has different treatment modalities that we can choose from. That includes the herbal medicine, acupuncture and moxibustion, massage, cupping, scraping, or qigong. So for fatty liver management, usually the very first line of treatment is weight loss. So it's been shown that losing 10% or more of your body weight is recommended, but even losing 3 to 5% of your starting weight can show benefits. So that together with healthy eating, with regular exercise, that is the foundation of treatment for non-alcoholic fatty liver disease. So if all that doesn't work, then your doctor might actually recommend you some drugs or even surgery. So for TCM, we can help with weight loss. We can actually recommend the diet choices according to your body constitution. We can recommend suitable exercises like qigong and TCM herbs that is specific to your symptoms. But so sorry, TCM, we don't do surgery. So for that, you have to still go back to your Western doctor. So let me share some of the research that's done for herbs. Firstly, for the lotus root extract, it has shown that it can actually help to reduce body weight, improve your liver function, decrease liver damage, and increase antioxidant activity in the liver. Fu Ling, which is a kind of fungus, has shown to have anti-inflammatory and antioxidant properties that can benefit your liver health by boosting your immune system, reducing the damage caused by inflammation, and protecting your liver from stress. Curcumin, which is the active ingredient, isolated from turmeric, the very common spice that we use in cooking curries. It can calm inflammation in the liver, protect your cells from oxidative stress, regulate fat storage, improving your liver function. The next one will be mai dong. So mai dong is a kind of root. It's a Chinese herb. It's shown to improve this non-alcoholic fatty liver disease in mice fed a high-fat diet by regulating the gut bacteria and affecting how the liver processes fats. So in general, we know that single herbs has been shown to have some effect, but in TCM, we usually combine multiple herbs together to create individualized formulas for optimal results. So for herbal prescriptions, it's also based on the predominant symptoms. So for example, do you have fatigue? Or do you have symptoms like bloating, indigestion, pain, or discomfort? And as mentioned before, for fatty liver, the main focus of it is to strengthen the digestive system to actually improve the metabolism. So a lot of people have this question, does TCM actually cause liver damage? Or if my liver enzymes are already elevated, can I use TCM? So generally, I'll say the rule of thumb is to buy your herbs from safe sources, from reputable sources. So some adulterated medications might claim that they are 100% natural or 100% safe, but they might have some ingredients in it that could cause liver damage. Or it might be prescribed by somebody who is not experienced or not properly trained. So please, if unsure, do not self-medicate and always go to a certified and licensed TCM practitioner. So a lot of research has been done into these herbs that cause some liver toxicity, and if we know that these herbs are toxic to you and you have some liver issues, we will not use this, we will use something else. In Singapore, HSA regulates the TCM products that come into Singapore. So that includes the licensing, the product listing, and it goes through strict quality checks and post-market monitoring. So this applies to all of the prepared Chinese herbs, including the pills, capsules, or the powdered form. So, but please note that raw herbs are not subjected to this pre-market approval and sale in Singapore. So, but if let's say your Western doctor says, please do not use TCM, you cannot use any herbs, or you don't like the taste of herbs, then there's always acupuncture that can help with fatty liver. So studies have shown that acupuncture is effective in treating fatty liver. It can help with the liver fat, lipid metabolism, and insulin resistance. Acupuncture is effective in lowering your total cholesterol, triglycerides, and LDL, and it's a safe treatment with minimal side effects and good efficacy. So usually for acupuncture, how will it be done? We will be targeting the meridians and the acupoints specific for strengthening your digestive system. So the needles will be put in the belly area, and then it will be done, some will be on the legs. So this will also apply, it will be quite similar to how we do for patients who come for weight management. So on the needle itself, we might actually clip on some electrodes, and that's called electroacupuncture. What it does is it will deliver a very small current to the needle itself to give you a stronger stimulation at the acupoint. So acupuncture combined with lifestyle modifications have been found to improve the liver fat status, sugar control, and insulin resistance. So this is not painful, it's just going to feel like a tapping sensation at the acupoint itself. So next is moxibustion. Moxibustion is burning of dried herbs on specific points of the body. And research has found that moxibustion has beneficial effects on body weight and blood lipids. So what it does is it will have a very warming, slight warming sensation on the body part itself. 推拿 or TCM massage. In Parkway Shenton TCM clinics, we have something called the robotic 推拿. So the physician will actually put in the acupoints, and EMMA, which stands for Expert Manipulative Massage Automation, will follow those points using sensors and 3D vision to actually measure the muscle stiffness, and you will massage the acupoints accordingly for muscle relaxation and pain relief. So we find that the force or the pressure that it uses is consistent, it's precise, and it's safe. So where do we do this? The acupoints that we have a row of acupoints all along the spine on the back called back shoe points. So there are a proportion of people with gastrointestinal problems that might have some soreness or some discomfort in the mid-back section. So we can see that the mid-back section actually corresponds to the acupoints for liver, gallbladder, spleen, and stomach. So basically your digestive system. So all these acupoints actually help to regulate the function of the respective internal organs. So what we do with the massage is we can actually target these areas to activate the acupoints and also to relax the muscles. That, together with the acupuncture done on the front of the body, can actually help to increase the efficacy of the treatment. So dietary advice. Dr. Louis has already covered some of the diets, but from the TCM perspective, we would say that high fat, high cholesterol, and high sugar foods. Sorry, if you have fatty liver, then please avoid or reduce all these kinds of foods. Generally, there's a lot of research done on the Mediterranean diet, as shown as the ideal diet for fatty liver. So there's a large focus on fresh fruits and vegetables, whole grains and legumes, healthy fats like olive oil, and a moderate amount of lean meats and fatty fish. So from the TCM perspective, these foods can invigorate the digestive system and increase metabolism. So foods like the hyacinth bean, chestnuts, and lotus seeds have quite high amounts of dietary fiber, and it's beneficial for the digestive system. Azuki beans, red beans, Chinese barley, loofah, winter melon, all these have a diuretic effect on the body. It can help to get rid of the excess water and heat in the body. And Chinese yam or sanyao is known to tonify the spleen to actually strengthen the digestive system. So one tea that you can use is actually the rose roselle tea. So it has high concentrations of antioxidants. It can be used to reduce your blood pressure, some appetite suppressing effects, and anti-inflammatory properties. So another tea that you can use is the Hawthorn lotus leaf tea. So this has shown to have high concentrations of antioxidants And the Hawthorne itself has been shown to improve blood flow. It might actually benefit your heart health. It can regulate fat metabolism and regulate your fat storage. So exercise-wise, the Singapore Physical Activity Guidelines recommend that you limit the amount of time spent being sedentary and to aim for 150 to 300 minutes of moderate aerobic physical activity per week. So here, under muscle strengthening, you can see that Tai Chi is actually listed as one of the examples. So Tai Chi actually originates from traditional Chinese martial arts and combines breathing techniques with a series of gentle postures to help improve the relationship between the body and the mind. So research have shown that Tai Chi can help to reduce your waist circumference, BMI, blood glucose levels, and insulin resistance in diabetic patients. So that suggests that they might have a potential for treatment in non-alcoholic fatty liver disease. Okay, next we'll go to this, where liver opens into the eyes. So for the Western doctors, they might not understand it well. How does this liver relate to the eyes? But in TCM theory, every organ has an association with a sense organ, and the liver is most closely linked to the health of our eyes. So any unpleasant signs of the eyes can therefore be used to assess the health status of the liver. So for example, if there is a deficiency in liver blood, you might get blurred vision, dry eyes, eye floaters, myopia, or impaired night vision. If there's an excess in liver heat, you might have blurry vision, red and bloodshot eyes, painful, burning, or severely itchy eyes. So this very recent research from last year shows that a dysfunctional liver is often accompanied by symptoms of distant organs, including in the eyes. So we can see in the picture that non-alcoholic fatty liver has sort of a linear increase with glaucoma. It has a relationship with diabetic retinopathy and also retinal vascular lesions. So targeting at the liver can actually help your eye abnormalities and actually vice versa. So I think this is quite common with the nature of our work now, looking at small screens and large screens for a long period of time throughout the day. So this is useful for dry, fatigued eyes. Chrysanthemum wolfberry tea. So take note that the chrysanthemum here that you use are the white ones and not the yellow ones. So the white chrysanthemum nourishes the eyes. So using that as a base, if let's say you have a deficiency in liver blood, then we add 3 to 4 red dates to this tea, which can nourish the qi and blood, helps with fatigue, weakness, and anemia. If on the other hand you have an excess in liver heat, then we add 10 grams of cassia seeds that can help to clear the liver heat to improve your eyesight. It can actually help to prevent constipation, reduce body weight and cholesterol in overweight patients. So this is a study that's done in collaboration with SGH. They found that acupuncture for dry eyes is more effective than using artificial tears alone. So acupuncture helps to increase the blood circulation around the eyes and stimulate tear production. So there are many acupressure points or acupoints around the eyes itself. We can actually do acupressure for yourself, especially if you are very tired at the end of the day looking at your screens. So just do it in a circular motion around the eyes, around all the acupoints on the eyes. Okay, so other functions of the liver in TCM. One interesting thing to note is in TCM, the liver controls how the regulations of emotion and your emotional health is. So very interestingly, if let's say you tend to be a very self-conscious or indecisive person, you might have liver yin deficiency. If you have a liver blood deficiency, you might feel insecure or nervous most of the time. If your liver qi is stagnant, it's not moving very well, you might be tense, irritable, and grumpy. So if you do know people who are very irritable, they might have some liver function issues according to the TCM theory. So in conclusion, if unsure, please do not self-medicate. Repeat again, please do not, and always go to a certified and licensed TCM practitioner. Buy your herbs from regulated sources, eat a healthy diet, and ensure there is regular bowel movements. Manage your stress well, sleep before 11 p.m., and try to avoid alcohol and quit smoking. So this is just the places of practice that we have. Shenton Parkway has 2 TCM clinics, one in Harbourfront and one in Toyi. Please feel free to come to us if you have any questions or would like consultation. So thank you very much. I hope you find this session useful. I'll hand it back.
Oh, thank you, Physician Tay. That was really, really great.
Thank
Learned so
you.
much from you. Thank you.